Hello, and thank you for joining today's webinar entitled Providing Professional Disinfection Services, How to Manage Germs Safely and Effectively. I'm Amy Mize with the Pesticide Program in EPA's Region 5 office in Chicago, and I'm honored to be your moderator, along with my colleague, Donald Baumgartner. I'd like to acknowledge and thank EPA's Center for Integrated Pest Management for facilitating this webinar. Today's webinar will focus on what you need to know if you or your business are offering disinfection services. Given the potential health implications from exposure to pathogens and the chemicals used to control them, this is a serious business, and it is vital to follow practices that offer safe and effective disinfection services. Although many of you have been offering these services for some time, this webinar may offer details and perspectives you may not have heard before. While we can't cover every aspect of this industry in 90 minutes, our speakers will provide a great foundation for covering the latest science about SARS-CoV-2 on surfaces, when to clean, when to disinfect, how disinfectants are regulated, and how to use them safely and effectively. We'll also discuss some of the regulatory requirements for people who apply disinfectants for hire and how to protect yourself by selecting, using, and caring for personal protective equipment correctly. Finally, this webinar will cover some of the business practices and challenges you may encounter. Next slide. The presentations and any non-EPA fact sheets, publications, reports, or web links provided during this webinar do not necessarily reflect the views or policies of the EPA or constitute EPA endorsement or recommendation for use. Before we begin, here are some tips for viewing the webinar. Next. To change between maximized and standard view of the presentation, click on the four-corner symbol highlighted by the yellow arrow. Next. If you're having technical difficulties, press the raise your hand icon highlighted by the blue arrow, and we'll do our best to help. Next, to download resource materials related to this webinar, press the paper icon highlighted by the green arrow. Next, and to pose a question, enter it into the question box, which is located by the red arrow, and click the send button. Please note that all participant mics will remain muted during this event. Details about obtaining a certificate of attendance will be provided at the end of the webinar. CEUs will not be offered directly for this webinar, but you can check with your certifying agency once you have your certificate of attendance, and contact us if you need additional information. Next slide. It is my pleasure to introduce our 5 distinguished speakers today. You'll hear from Jonathan Yoder with the Centers for Disease Control and Prevention. He develops and coordinates waterborne disease outbreak and response activities, including developing resources, tools, and guidance for state and local health departments. During CDC's COVID-19 response, he led the water, sanitation, and hygiene, and mitigation, implementation, and technical assistance teams, and the Community Intervention and Critical Population Task Force. Jonathan holds master's degrees in social work and public health. Kristen Willis works for the U.S. Environmental Protection Agency as the chief of the Efficacy branch in the Antimicrobials Division of the Office of Pesticide Programs. Prior to joining EPA in 2016 as a senior scientist, Kristen obtained a Bachelor of Science and a PhD in microbiology. Her graduate work focused on vaccinovirus, a close relative of smallpox virus. Kristen was a National Research Council postdoctoral fellow from 2010 to 2013, working for the Department of Defense. Then she worked as a research microbiologist with Defense Threat Reduction Agency. Next slide. You'll also hear from Jennifer Wren, who has been the Agricultural Inputs Division Director for the Georgia Department of Agriculture since 2018, following a 2-year position as the division's enforcement manager. The Ag Inputs Division regulates commercial and private pesticide applicators, as well as pesticide producers and dealers in Georgia. Jenny previously worked for the Georgia Department of Public Health and interned at the Agency for Toxic Substances and Disease Registry. Jenny holds a Bachelor of Science degree in biology and a Master of Public Health and Environmental Health Science. Carrie Richards is currently the Education Program Developer with the National Pesticide Safety Education Center. Carrie works with Pesticide Safety Education Program, or PSEP, to identify existing educational resources and tools, and to develop new tools to meet the needs of PSEP coordinators. Carrie also works cooperatively with PSEPs to identify and facilitate opportunities to generate revenue to improve the sustainability of their programs. To accomplish these goals, she collaborates with numerous stakeholders, including industry, state and federal agencies, and organizations supporting pesticide safety education. In addition to her 70% appointment with the National Pesticide Safety Education Center, Carrie works as a part-time PSEP coordinator, helping the University of Delaware to establish a sustainable PSEP program. Carrie previously worked for the Penn State PSEP for nearly 30 years. And last but not least, Jim Fredericks, the Vice President of Technical and Regulatory Affairs for the National Pest Management Association. He's responsible for NPMA's technical publications and educational efforts and provides strategic direction to NPMA's state and federal public policy efforts. Jim also serves as the Executive Director for the Pest Management Foundation, a nonprofit foundation whose mission is to advance the pest management industry through education, research, and training. Jim is a board-certified entomologist and holds a BS in biology education, as well as master's and PhD degrees in entomology. Prior to joining NPMA in 2010, Jim spent 11 years working for a large regional pest management firm serving the mid-Atlantic states. Next slide. To start off our discussion, please welcome Jonathan Yoder with the CDC, who will provide an overview of infection transmission, prevention, and control. Next slide.
Thank you for your interest in COVID-19 prevention and the role of surface cleaning and disinfecting and protecting our health, both at home and in community settings. My name is Jonathan Yoder, and I work at CDC on water, sanitation, and hygiene, as well as in CDC's COVID response. I'll be talking to you today about when to clean, when to disinfect, and what the science says about the virus that causes COVID-19 on surfaces. Next slide. In this presentation, I'll give an introduction to the topic of how SARS-CoV-2, that's the virus that causes COVID-19, can be transmitted, and the role that surfaces might play in transmission. I'll give an update on some of the science that's informing our understanding of how the virus may be spread through surfaces, including the effectiveness of prevention measures. And based on scientific evidence, I'll discuss updated recommendations for cleaning and disinfecting surfaces at home and in indoor community settings. Next slide. SARS-CoV-2 transmission is complicated. And as you can see from this figure, this is really a lot to take in. And especially if we're thinking about transmission of the virus from contaminated surfaces, or sometimes what people talk about as fomite transmission. And in this figure, transmission pathways are illustrated. And as a reminder, the primary way that the virus is transmitted is through droplets or aerosols. Often it's not possible to isolate a single pathway responsible for a case or a cluster of cases. But for the purpose of this presentation, we'll focus on transmission related to surface contamination, which is at the center bottom of the figure. Next slide. And to make it a little bit easier to think about just this particular example, actually, can you go ahead and advance the slides so we can see? I think this has some animation that's still in there. But this adapted figure will show just the surface transmission route. And for this transmission route, an infected person has normal respiratory activity, in other words, regular breathing, or they might cough or sneeze, expelling respiratory secretions and large droplets in addition to aerosols and small droplets. Focusing on the large droplets and respiratory secretions, these can directly contaminate the infected person's hands or may land on surfaces in the area surrounding the person. Thus, the virus can contaminate surfaces through droplets or when contaminated hands from an infected person touches a surface. The virus can be transmitted from the surface to the hand of the susceptible person when they touch the surface, and the virus from a susceptible person's hands can be transferred to their eyes, nose, or mouth when they touch their face. That person then can become infected. Click forward a couple slides. As we think about things like masks, cleaning hands, they can all interrupt those transmission pathways and prevent the transfer of virus from contaminated hands to a susceptible person's face. Next slide. Transmission of the virus that causes COVID-19 by direct contact and inhaling aerosols and droplets is more likely than by touching surfaces. This same relative transmission risk is supported by scientific evidence for other respiratory illnesses, particularly for transmission of cold and flu viruses. Respiratory viruses such as SARS-CoV-2, which is shown in the image on the right, influenza virus, rhinovirus, which is the one that causes colds, have an outer layer called an envelope that can be damaged relatively easily in the environment, especially outdoors where sunlight and heat can damage the virus quickly. Respiratory etiquette, things like sneezing into a tissue or cleaning hands, have demonstrated effectiveness for preventing respiratory illness. Next slide. During the pandemic, CDC has collected data on unintended health impacts from increased use of cleaning and disinfection products, and heard many reports from partners and the public on the dangers, on the challenges in following our guidance. There have also been reports of highly visible cleaning and disinfection behaviors that may not be effective, including the outdoor use of fogging sprayers, such as shown in this picture. Such cleaning procedures might give people a false sense of security that they are being protected from the virus, but that might not be warranted if other prevention measures such as vaccination, wearing a mask, physical distancing, and hand hygiene are not being consistently performed. It could make people feel less need to engage in these other important prevention measures. Next slide. Based on surveys and public inquiries regarding how, when, and what to use to clean and disinfect surfaces, one of the consequences of frequent disinfection is that people may be using disinfectants in ways that are unsafe. We've gotten a lot of public inquiries that indicate that people may purposely drink, inhale, or spray their skin with disinfectants without understanding that use of disinfectants in this way can cause serious harm to their bodies. Data from a recent CDC survey suggests important gaps in public knowledge about the practice and safe use of cleaners and disinfectants. For example, only 50% of the public knew that bleach should not be mixed with ammonia. Obviously, this creates a toxic gas. And 19% washed food products with bleach, which if not done properly could lead to consumption of bleach that isn't washed off and can damage the body. And 18% used household cleaners on bare skin, which is not the way those cleaners are designed to be used. Next slide. In association with a dramatic increase in disinfectant use and gaps in public understanding of proper use and safety practices, the National Poison Data System surveillance during the pandemic shows that calls to poison centers for disinfectants in 2020, which is the black line shown on this chart, exceeded calls for 2018 and 2019, which are the gray and blue lines in the figure. The yellow line depicts calls so far this year and shows continued higher call volumes for disinfectants. But the good news is that so far we're seeing a much lower number than we saw in the spring of 2020. Next slide. So using evidence from our epidemiologic and field investigations, the experimental studies, and quantitative risk assessments, CDC completed a scientific review of SARS-CoV-2 surface transmission risk. Next slide. And based on the findings from these sources of evidence, CDC determined that the risk of surface transmission is low, and it is secondary to the primary routes of virus transmission through direct contact, droplets, and airborne aerosols. We found little evidence indicated that there is significant transmission of the virus from contaminated surfaces, which we talked about as fomites, although it can be difficult to distinguish surface transmission from other transmission routes. While there are some case reports that suggest that people are at increased risk of surface transmission within the first 24 hours after a sick person has been in a space. So one study of households in which an infected person was residing found that cleaning and disinfection appeared to be associated with lower transmission of the virus within that household. So those were studies where they had someone who was known to be infected with SARS-CoV-2. Next slide. One of the important sources of information used in the science review or quantitative risk assessments. Quantitative risk assessments help us understand and characterize the relative risk of transmission and evaluate the need for and effectiveness of prevention measures. Multiple published risk assessment studies were available, and all of them supported a determination that the risk from surfaces is low and generally less than 1 in 10,000, meaning that each contact from a contaminated surface has less than a 1 in 10,000 chance of causing an infection. The risk assessments use surface contamination data from indoor and outdoor surfaces. The risk of infection from touching a surface is generally less in an outdoor setting than an indoor setting due to harsher environmental conditions outdoors, like sunlight and heat. And wearing a well-fitted mask reduces the amount of respiratory droplets and therefore the virus that can land on surfaces, and is a prevention measure that further reduces surface transmission risk. Evidence also shows that hand hygiene can act as a barrier to transmission and thus further reduces surface transmission. Next slide. In our scientific review, we looked at experimental data from studies investigating the survival of SARS-CoV-2 on common indoor surfaces. We focused on survival data under typical indoor conditions, with temperature in the range of 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit, and relative humidity of 30 to 65%. Most studies reported the virus dying off rapidly on soft surfaces like cloth, with inability to detect infectious virus within minutes to hours. For hard surfaces like stainless steel, researchers generally found that 99% of the virus died off within 3 days, as depicted in the graph on the right. In this graph, the amount of virus, shown here using the word titer at the beginning of the experiment, that's at time 0, is shown as black dots in the upper left corner of the at the level of 10 to the 5th, or 100,000 virus particles. As the virus particles sit on the surface, in this case stainless steel, they become more and more damaged over time and lose their ability to infect. In this set of experiments, the amount of virus shown as dots decreases with time measured in hours. In these experiments, after approximately 72 hours, the dots are approximately 99% lower than at the start of the experiments. The straight green lines are a way of showing how fast the die-off is occurring. We looked at published experimental data for hard surfaces commonly found in homes and facilities, such as stainless steel, plastic, and glass. And in general, these experiments indicate that 99% of the virus will die off on hard surfaces in indoor settings within 3 days. Next slide. In addition to examining the relative risk of surface transmission, the scientific review or the scientific brief examined 2 of the main ways that we can reduce the risk of surface transmission after a surface is already contaminated, which are cleaning with household cleaners containing soap or detergent, or using a disinfectant product registered with EPA's List N, which is EPA's list of products determined to be effective against SARS-CoV-2. Cleaning is a process of removing dirt and germs from surfaces, whereas disinfection is a process of killing germs on surfaces. Cleaning and disinfection can both reduce the risk of surface transmission, and I will describe a bit about how these processes work. Next slide. Cleaning with a soap or detergent product reduces the amount of soil on surfaces, including dirt and germs like viruses. Soap and detergent chemicals are molecules that have one end of the molecule that is attached to water, shown in the images as blue dots attached to squiggly lines, and the other end of the molecule that is attracted to organic matter, like dirt and germs. Soap and detergent molecules create micelles, which are spherical structures that surround dirt and germs and help remove them through washing and wiping off a surface. Cleaning with soap and water, or a detergent product made for surface cleaning, can reduce virus levels on surfaces by 90 to 99%, depending on the cleaning method and the surface being cleaned. For SARS-CoV-2, shown in the image in black with spikes, soap molecules can also damage the virus. However, soap and detergent products are designed for cleaning, not for killing the virus unless they contain a disinfectant chemical and are registered on EPA's List N for products that are effective against SARS-CoV-2. Next slide. Disinfectant products are designed with chemicals that cause damage to the outside or inside part of germs, so that they cannot cause infection. There are many types of disinfectants that are effective against the virus that causes COVID-19. To substantially kill the virus on surfaces, the surface must be treated with a disinfectant product registered with EPA's list N. And the directions on the disinfection product label should be followed to kill that virus. Surfaces should be cleaned before applying a disinfectant so that the disinfectant can work well. If the disinfectant product does not already contain a cleaning agent, the surface should be cleaned before being disinfected. Next slide. To summarize, the scientific evidence indicates that the risk of surface transmission is low in most situations. Mask wearing can substantially reduce the amount of virus from infected people that gets into the environment and onto surfaces. Hand hygiene and cleaning and disinfection can be effective for reducing surface transmission risk. When the SARS-CoV-2 virus lands on surfaces, these viruses rapidly die within hours on soft, porous surfaces. They can live longer on hard surfaces, but can be expected to die off by 99% within 3 days. Cleaning alone can be effective for removing the virus from surfaces and reducing the already low surface transmission risk. The EPA list N disinfectants are highly effective for killing the virus. And disinfection of surfaces is warranted within the first 24 hours after surface contamination, when the infectious virus is more likely to be present. Next slide. So I've gone through a lot of the science behind our recommendations, but based on that science review, CDC updated its guidance on cleaning and disinfection in homes and facilities in community settings. And so let's walk through that. Next slide. It's important to note that the science review and updated guidance are for community settings and not for healthcare settings or for facilities that have specific regulations, such as food service or other similar industries. As a general principle, in most situations, cleaning surfaces using soap or detergent and not necessarily having a disinfecting step is enough to reduce the already low risk of virus from surfaces. Mask wearing and practicing hand hygiene are also important for reducing surface transmission risk. Next slide. In homes and shared housing, CDC recommends cleaning regularly. For example, something like daily and after there have been visitors in the home. Disinfecting surfaces is typically not necessary unless there's a sick person or someone positive for COVID-19 has been in the home in the last 24 hours. When cleaning, it's important to focus on high-touch surfaces like doorknobs, handles, light switches, tables, countertops, and more in-depth disinfection in areas occupied by a sick person is needed if someone in the household is sick. And use products that are suitable for each surface and always follow the label instructions on the product. Next slide. In community settings, in community settings, in most situations, daily cleaning is enough to reduce the virus on surfaces. There are some situations that might prompt more frequent cleaning and warrant choosing to disinfect, and this is in facilities. For example, in facilities where there's high transmission in the community, where the mask usage, particularly that among people who are unvaccinated, is low, and where hand hygiene is not performed frequently and consistently, and in places where people in the facility are at increased risk for severe illness from COVID-19. And again, focus on those high-touch surfaces, and if you're disinfecting, use an EPA list N disinfectant and follow the product use guidance on the label. Next slide. Now, it's important to think through what to do if a person is sick. If a person is sick or positive for COVID-19, if they've been in a facility or in a home, their additional cleaning or disinfection might be needed. If they're residing in that space or been in that space in the last 24 hours, disinfect those surfaces after cleaning using a product from EPA's list N. If it has been more than 24 hours but less than 3 days, disinfection is not needed, but surfaces, particularly those commonly touched surfaces, should be cleaned with soap and water or a detergent product. And if it's been more than 3 days since the person who is sick or has COVID-19 has been in the space, there's no additional cleaning or disinfection needed. But go ahead and do that routine daily cleaning, which is is recommended. Next slide. And then here, if that person has been in the space in the last 24 hours, here are those steps for cleaning and disinfecting. Before cleaning and disinfecting the space, close off those areas used by the person and wait as long as possible to enter the room, at least several hours. And the reason for that is there's still virus that could be circulating in the air in those minutes to hours after the ill person's been in that room. And while cleaning and disinfecting, ventilate the room by opening doors and windows, get as much outside air into that room using fans or central air, and wearing a face mask and gloves while inside the area. And if you're vacuuming, use a vacuum that's equipped with a HEPA filter. That's a high efficiency particulate air filter. Next slide. Finally, here are some links to resources that CDC has on this topic. I appreciate your interest in CDC's recommendations for cleaning and disinfection, as well as the science behind the role of surfaces in COVID-19 transmission. And I look forward to answering additional questions that you have. Thank you. I'll now turn it back to the moderator.
Thank you, Jonathan, for the latest information and best practices. We do see some comments and questions coming in. Please keep those coming, but be aware that we will get to all of those questions once at the end of all of the presentations. So once our speakers are completed, we'll have a whole Q&A session. Now, to involve and keep our audience engaged, we do have our first knowledge check question. Please select the best option in response to this question appearing on your screen. What steps should be taken to control a pathogen on surfaces? For A, nothing, there is no risk after a few minutes. B, always use a disinfectant. C, learn about the pathogen to understand the best control options. D, spray the surface with bleach and wipe it off immediately. Or E, apply a sanitizer to your skin to protect yourself. So feel free to put your answers in there and submit that, and we'll get to the results in just a minute. Okay, so we have the largest majority of folks with the correct answer: to learn and understand the pathogen for the best control options. We see a few people here, a fairly decent number, talking about always using a disinfectant. Jonathan, can you make just a quick comment about that response?
Wow, fantastic work. You all paid attention to know what is the right answer here. And I think just a couple notes on this. Obviously this talk focused specifically on SARS-CoV-2, so the virus that causes COVID-19. There are lots of other pathogens, bacteria, parasites, fungus that are also important, and so they all have different abilities for disinfectants and different ways you'll want to address them. And so that's exactly right. We're focused on COVID-19 in this talk, but there are lots of other important things that you'll want to learn about as far as the way to deal with them. And frankly, there are other pathogens that are much more difficult to deal with cleaning and disinfection, and the risk of surface transmission is much higher. So thank you for that, for listening, and that fantastic response. Thank you.
Great. Thanks, Jonathan. Next, you'll hear from Kristen Willis from the US EPA, who will discuss the regulation, selection, and proper use of antimicrobial pesticides. Kristen, the mic is yours. Next slide.
Thanks so much, Amy. So as Amy said, my name is Kristen Willis, and I'm a branch chief in the Antimicrobials Division within EPA's Office of Pesticide Programs. EPA's Office of Pesticide Programs is responsible for regulating and registering pesticides, including antimicrobial products. Can I get the next slide, please? So maybe while we wait, I will give you just a brief overview of our journey today. So we are going to start by discussing understanding disinfectants and EPA's role in regulating them. And then I will give a brief introduction to antimicrobial product registration, including the anatomy of an EPA label. And then we'll take a deeper dive into public health efficacy claims. Then we'll talk about best practices for safe and effective use of antimicrobial products, followed by an overview of EPA's response to COVID-19, including, as Jonathan already mentioned, List N. We'll finish up by touching on pesticide devices and novel product types. So I'm planning to cover a lot of topics today, so know that this talk is only intended to give you a high-level overview of some of the most important aspects of antimicrobial product registration and disinfectant use.
While we're waiting on that, I will go ahead and ask Jonathan a question or two here that we have in our poll. Jonathan, will spraying Lysol in the air kill COVID-19 viruses still floating in the air?
So this is a really good question, and again, I'm not a expert on what's in Lysol, but in general, it probably would do something to the virus. I think the challenge is always then thinking about the concentration in the air, and whether that's an effective way of dealing with it. In lots of situations, there are much more effective ways of dealing with the virus in the air rather than other than spraying products in the air, and those include ventilation, wearing masks to reduce the amount of virus. And so I wouldn't recommend, while it may kill it in the air, to constantly do it to try to kill it doesn't seem to be an effective way to deal with potential virus particles in the air. Thanks for that question.
Thank you, Jonathan. And again, thank you for the question. Kristen, it looks like you're back on board. So thank you all for your patience, and proceed, please, Kristen. Thank you for your patience.
Thank you so much. Yeah, thanks everybody for your patience. I'm sure we just wanted to make sure that you definitely knew the answer to that knowledge check. So we will continue on our journey down, learning about regulation of antimicrobial products. So I already kind of talked through this slide, which is just our overview. So in the interest of time, I will take us to the next slide, please. So to start, I want to briefly describe how EPA's pesticide program is involved in regulation and registration of antimicrobial products. FIFRA, which stands for the Federal Insecticide, Fungicide, and Rodenticide Act, is the law that gives EPA the authority and responsibility to regulate any product used to kill pests. In addition to those types of traditional pests that you might be thinking of, like weeds and insects, that we commonly associate with pesticide use, microorganisms are also considered as pests. Before EPA registers any antimicrobial pesticides, including disinfectants and sanitizers for sale and distribution, EPA performs a comprehensive scientific risk assessment of the product. We evaluate the entire formulation, which includes not only the active ingredient, so for example, sodium hypochlorite or hydrogen peroxide, but also the inert ingredients in the formulation, which could include things like surfactants or other ingredients to increase the stability, dyes or fragrances, for example. We also review the proposed use pattern to ensure that no unreasonable adverse effects on human health or the environment will occur when the product is used according to the label directions. EPA reviews both product-specific data for the formulation as sold, as well as generic data for the active ingredient alone. And together, this information determines what the final product label will look like. So let's take a closer look at the sample label. Next. This is a sample portion of a generic EPA label, and I want to highlight just a couple of things. The EPA registration number, which you can see in the bottom right corner, may be a two-part or three-part number. The first set of numbers identifies the parent company, and the second set is the product number for that company. Sometimes a product has a third set that is used to identify an authorized supplemental distributor of the product, but not all products will have that third part. The active ingredient or ingredients are listed along with the percentage in the formulation. So you can see that's on the bottom left corner. The label is also going to include some important precautionary information. And we'll take a deeper dive on the next slide, but this includes the signal word. In this particular case, it's danger. And that word is determined by the acute toxicology endpoints. There's first aid instructions, phone numbers to call for help or more information, as well as the keep out of reach of children statement that is required on all pesticide products. Now you're going to hopefully be tired of hearing me say this by the end of the presentation because I'm going to say it repeatedly. It's critical to read the label and follow the directions to ensure safe and effective use of disinfectant products. Next. As we touched on in the sample label, the precautionary statements are one of the most important parts of the label and provide the information that you need to use the product safely. The signal words indicate a product's potential for making you sick. So while our sample label had the signal word danger, that's the highest level signal word, a product may also have no signal word. It may have the signal word caution, which appears on products that are the least harmful, or warning, which is a product that is more harmful than caution, but less than danger. Products are also required to have a keep out of reach of children statement unless that requirement is waived. The statement is important because children are considered to be a sensitive population as they're less able to read complicated labels or be informed about the risks and more likely to put things in their mouths. Also included are the first aid statement, instructions for personal protective equipment or PPE, and hazards to humans and domestic animals. So for more information, see the resources that I've provided on this slide. Next, we'll take a closer look at the efficacy claims. Antimicrobial claims are claims that a product destroys or suppresses microorganisms in the inanimate environment. These claims must be supported by product-specific efficacy data. Efficacy comes in two types. You have public health and non-public health. Public health claims are claims to control microorganisms that affect human health, including SARS-CoV-2, the cause of COVID-19, as well as other important public health pathogens that you may be familiar with, such as MRSA, C. difficile, norovirus, or the cruise ship virus, for example. EPA reviews all efficacy data for public health microorganisms prior to approval of the product registration. Every public health organism on the label must be specifically tested in order to substantiate that claim. Now, in contrast, non-public health claims, which are, for example, claims to kill odor-causing or spoilage bacteria, or algae, are not reviewed by EPA. However, the registrant is required under FIFRA to have data on file to demonstrate that those claims are accurate. Next, we are going to do a quick pop quiz. So our question is true or false. The terms disinfectant and sanitizer mean the same thing. And I will give you a second to select your response. All right, so it looks like we got about 75% or 3/4 that said the term disinfectant and sanitizer mean the same thing as false. Absolutely, they are two different claims. They are two different types of products. So hoping we can transition to the next slide. And one more. Perfect, thanks. So I'm going to start by giving you the statutory definition of these two terms, which are defined in the Federal Code of Regulations. But we'll take a deeper dive in the next slide to better explain what these mean. So disinfectant is defined as a substance or mixture of substances that destroys or irreversibly inactivates bacteria, fungi, and viruses, but not necessarily bacterial endospores in the environment. Now, the definition of sanitizer, in contrast, is a substance or mixture of substances that reduces the bacterial population in the inanimate environment by specific significant numbers, such as a 3-log or 99.9% reduction, but does not destroy or eliminate all bacteria. So one thing I want you to notice in those two definitions is that while disinfectant talks about bacteria, viruses, and fungi, the definition for sanitizers only talks about bacteria. Next slide. Shown here is the hierarchy of the most common public health efficacy claims. While it's not the focus of my talk today, one category that I'll make you aware of is the top tier of claims. So at the tippy top of the pyramid are our sterilant claims. Products with sterilant claims must demonstrate efficacy against the hardest to kill form of microorganisms, which are bacterial endospores. On the right, you'll see the relative resistance of different types of microorganisms to chemical disinfectants. So starting with the least resistant at the bottom, which of course are our envelope viruses, as Jonathan talked about in the previous talk, all the way to spores at the top. And then in between are other types of viruses as well as bacteria. The middle tier public health claim is the disinfectant claim. Products with a disinfectant claim must demonstrate an approximately 4-log reduction in bacteria. That's a 99.99%, and a 3-log reduction in virus, or 99.9. These are in general the products that are going to make up list N, which again Jonathan talked about, and I will also be talking about in subsequent slides. At the bottom of the pyramid is the sanitizer claim. Sanitizers have historically been limited to claims for bacteria only. And there are two different types of sanitizer claims. There's actually food and non-food contact. For non-food contact, products must demonstrate a 3-log reduction. So hopefully that helps to explain the difference between disinfectant and sanitizer products. And next up, we have our second pop quiz. So our true or false question is, hand sanitizers are different from hard surface disinfectants and hard surface sanitizers. So I'll give you a second to consider if that is true or false. All right, outstanding. So the vast majority, 92% of you got this one right. Hand sanitizers are in fact different from hard surface disinfectants and hard surface sanitizers. And I'm going to tell you why on the next slide. Hand sanitizers or antiseptic washes and antibacterial soaps are regulated by the Food and Drug Administration, or FDA. EPA registered surface disinfectants, including surface wipes, should not be applied on your skin or ingested. And this is a really important point. EPA registered surface disinfectants or sanitizers, unless specified on the label, are not intended to be applied to your skin. That regulatory authority rests solely with FDA. And for more information, we have an FAQ on our EPA website, which addresses additional information from FDA on regulation of hand sanitizers. So take a deep breath. We're done with our pop quizzes. Next, we'll turn to best practices to ensure safe and effective use of disinfectants. As you've already heard me say once, it's critical to read and follow the label directions for use. The label is going to tell you everything you need to know to use a product safely and effectively. So in addition to those precautionary statements that we already discussed, the label is also going to tell you how to apply the product. For example, if the product is a concentrated liquid, the label is going to tell you how to dilute it. It's also going to tell you how long the product must be in contact with the surface, also called the contact time, in order to kill the intended pest. And different products have different directions for use. They have different contact times as well. Children should not apply disinfectants and should not have unsupervised access to disinfectants. And finally, when you use disinfectants, follow best practices for safety and efficacy. And we are going to walk through those best practices on our next slide. So this graphic is one of my favorite infographics that EPA posted during the pandemic. And while it's written specifically for COVID-19, the information here is mostly applicable for all other public health pests. The infographic is separated into 3 columns. So on the far left, you have your good ideas. In the middle, you have be careful or caution, and on the far right, you have don't do it. So let's start all the way on the left column with the good ideas. So first, follow CDC state and local public health guidelines for COVID-19. So as you know by now, the guidance changes as the science changes. It's important to stay up to date and follow the most recent guidance. As Jonathan mentioned in his talk, the risk of getting COVID-19 through contaminated surfaces is low. Clean surfaces with soap and water. As Jonathan also mentioned, normal routine cleaning with soap and water lowers the risk of spreading germs and dirt. And finally, use EPA registered disinfectants according to the label directions. Now that's the 3rd time I've emphasized following the label directions. As you've already heard me say, disinfectants further lower the risk of spreading COVID-19 and other pathogens on the label by using chemicals to kill germs. Use disinfectants on high-touch surfaces, in particular when you suspect that someone around you is sick with COVID-19. So shifting to the middle column, the be careful column. At the top, be careful using disinfectants around people with asthma. Disinfectants can trigger an asthma attack, and if you have asthma, you may need to take precautions, such as avoiding areas where cleaning and disinfection are occurring, or making sure the space is well ventilated. Throughout the pandemic, there has been intense interest in ways to apply disinfectants in large spaces quickly. Fogging, fumigating, and wide area or electrostatic spraying are some of the most common ways to quickly apply a product over a large area. Be careful with these types of applications. Make sure the product label includes directions for that application method and follow the label precautions. If the product isn't labeled for that application method, that means EPA does not have data on the safety or efficacy, and using it may be risky or ineffective. Similarly, be careful with UV lights or ozone generators. These may be risky and ineffective. EPA cannot verify if or when it is appropriate to use these devices, as EPA does not register these types of devices. We'll talk a little bit more about devices in our later slides. Finally, moving all the way to the right in the don't do it column. As we've already mentioned, don't ask children or students to apply disinfectants. If used or stored incorrectly, they can harm children's health. Don't ignore the label directions. If you don't follow the label directions, products may be ineffective or unsafe. Don't apply to skin, pets, or food. Don't dilute disinfectants or mix them with other chemicals unless it's specified on the label. One important, really critical message, don't think that twice the amount will do twice the job. EPA evaluates each product for safety and efficacy prior to approval, and it's critical to follow the label directions. And finally, don't use unregistered disinfectants. As we talked about with a sample label, if, with the EPA registration number, if a product says it kills SARS-CoV-2 or any other public health pathogens and it doesn't have an EPA registration number, it may not be safe or effective. Federal law requires disinfectants to be registered with EPA. Next. In response to the COVID pandemic, in March 2020, EPA published a list of disinfectants expected to be effective against SARS-CoV-2. This list has been updated weekly since. To date, the list includes over 560 wipes, sprays, and products that are effective because they meet one or more of the following criteria. They have demonstrated efficacy against the specific SARS-CoV-2 virus. They have demonstrated efficacy against a pathogen that is harder to kill than SARS-CoV-2. So remember in our previous slides, we had the hierarchy of microbes. So in those cases, a product has demonstrated efficacy against a harder to kill pathogen. Finally, they've demonstrated efficacy against a different but close family member, a different human coronavirus similar to SARS-CoV-2. Currently, there are over 161 products on List N that have been specifically tested against SARS-CoV-2. At the start of the pandemic, of course, there were no products with this claim as the virus was brand new, so that number has been growing over time. The list also features companion FAQs for disinfectants and COVID. So one fun fact, EPA also has a series of disinfectant lists for a wide variety of public health pathogens. List N is just one in that series. The lists are named A through now P. List N was named because at that time it was the next letter in the alphabet. So that is the origin of List N naming. Next, please. So shown here is the List N webpage. It is conveniently available in an app-based form for easy use on mobile devices. The goal was to ensure end users could browse the list while, for example, shopping for disinfectants in the store. Next. EPA has some great resources for using List N, which include a step-by-step instruction on how to determine whether a product that you may be looking at will kill SARS-CoV-2, as well as a video tutorial on YouTube for List N. Next. I want to shift to pesticide devices. So I mentioned these already on our best practices slide, but if you're not familiar, pesticide devices by definition work by physical means and must not contain a substance. A few examples that you may recognize include devices that solely use ultraviolet light, ozone, or photocatalytic activity. I'll note that it's not always cut and dry in terms of what constitutes a pesticidal device, as over time these have become increasingly complicated. EPA does have a review process for companies to request a determination of if a product is considered a pesticidal device. While EPA regulates devices, we do not register them, which means that no pre-market review is conducted to ensure that claims for efficacy and safety are substantiated. However, under FIFRA, companies can't make false or misleading claims on their labels and must be able to substantiate those pesticidal claims. It's just that EPA doesn't review them pre-market. Often EPA becomes aware of devices through the notice of arrival process, which is time sensitive, as shipments may be delayed and fees incurred if a shipment is stopped, a shipment of devices is stopped. And for more information on devices, you can see the link provided. Next. Over the course of the pandemic, EPA has authorized a number of emergency authorization under EPA's Section 18 authority. Section 18 of the Federal Insecticide, Fungicide, and Rodenticide Act allows EPA to exempt state and federal agencies from certain provisions and allow temporary unregistered pesticide use under certain emergency conditions. I'll highlight that only public agencies, including states, can submit requests under this provision. Additionally, these are temporary. Typically, the longest approval time is going to be 1 year. And they're really intended to bridge the gap to a nationwide registration when there's no product that currently exists to meet the need under the emergency. Prior to approval, EPA reviews the safety, benefits, and efficacy information on an expedited basis. We typically try to prepare decisions in 45 days or less. States or federal partners oversee the process and have specific requirements for reporting and tracking in addition to the application process. Next. EPA has authorized several antimicrobial products under Section 18 during the pandemic. These include products that are residual or provide long-lasting efficacy, formulated as coatings, as well as products to treat the air. And you can find more information at the link provided on the authorizations approved through the course of the pandemic. Next. Finally, I want to highlight the work that EPA's Office of Research and Development, in collaboration with the Office of Pesticide Programs, has conducted on novel antimicrobial products. So the vast majority of products on List N are for use on hard, non-porous surfaces. So for some of these novel product types, which include products that provide long-lasting or residual efficacy, formulated as coatings and paints, for example, products for treatment of air, as well as personal protective equipment, and finally devices. So they have a great research page, and I've provided the link here so you can see about all of the exciting research on novel product types being conducted by our research office. Next. So in conclusion, EPA regulates any pesticide product that is sold and distributed in the US, including antimicrobial pesticides. The most critical take home I want you to have today is to read the label to ensure safe and effective use of a pesticide. And finally, take advantage of the EPA resources highlighted in this presentation to better understand product labels. And with that, I will thank you and turn it back to Amy.
Awesome, Kristen, thank you for that summary on the regulations, safety, and efficacy of disinfectants. And our apologies again for the disruption. Our next speaker is Jennifer Wren with the Georgia Department of Agriculture, talking about pesticide applicator certification requirements and enforcement. Please welcome Jenny Wren. Next slide.
Good afternoon. I'm going to apologize in advance. I work in downtown Atlanta and there is going to be some background noise, so I hope it's not as loud as I fear that it is. But again, I work for the Georgia Department of Agriculture, and part of what we do is to oversee the companies that provide sanitation and disinfection services. We do this to make sure that antimicrobial pesticides are used safely and effectively. Although my experiences will be specific to the state of Georgia, there are certain basic requirements that apply in every state, territory, and tribe in the United States, and I've tried to make this presentation relevant to all audiences. Next slide. In the US, each state has an agency in charge of pesticide-related issues. It may be called the Department of Agriculture, Pesticide Regulation, Environmental Conservation, or something similar. On tribal land, pesticide regulations may be enforced by a tribal designee or by the US EPA. If you want to be connected to these agencies in your state or tribe and discover how they can help you, visit the webpage of the National Pesticide Information Center to search for your local resources. They're always a good place to start, no matter what. Next slide. There you'll find contact information for county agents and university extension and the public health and pesticide regulatory agencies in your area. These organizations can explain what is required to commercially apply pesticides, including disinfectants, in your state, as well as point you to the rules and regulations that govern this type of work. Next slide. We've already covered the basics when it comes to pesticide products, or Kristen did, but it's always worth emphasizing that any instructions you find on a product label should be followed exactly. Many of the penalties we administer at my department involve an applicator not following label directions. And this type of violation often has the most serious consequences in terms of human health or the environment. So again, it bears repeating, the label is the law. Next slide. A restricted use pesticide, or RUP, is one that can only be sold to a certified applicator, and all other registered pesticides are considered general use. All restricted products will be clearly labeled as such, and you can see an example of what that might look like at the bottom of the slide, where it says in bold, all capital letters, restricted use pesticide. Most antimicrobial pesticides are general use or unclassified pesticides, but it's important to note the distinction because in some states, whether or not you are required to get a license or certification depends on the type of pesticide that you're going to use. Federal law only requires that any person who applies RUPs be certified, but most states, including Georgia, have stricter requirements. We require that all commercial applicators of pesticides, including sanitizers and disinfectants, be certified. Next slide. EPA regulations establish minimum standards of competency for pesticide applicators that use RUPs, and then state, territorial, and tribal authorities handle the actual certifying of applicators. You must be certified in each state, territory, and area of Indian country where you make restricted use pesticide, or RUP, applications. But you should verify that you are meeting local requirements, which again may be stricter. And you should contact the certifying agency to find out. Next slide. We have a specific state law that governs pesticide use in Georgia, as do most states, and we require the passing of an exam with a score of 70% or above before we will issue a pesticide applicator's license. Testers must pass a core exam that covers basic pesticide knowledge, as well as an additional exam for any specific categories of pesticide use in which the individual plans to operate. And the basic elements of that core exam will be the same in any certification exam in the country. Next slide. In Georgia, we have 16 commercial categories for pesticide applicators. There are 10 basic categories of certification that will be found in some form or fashion in every state, territory, and tribe, although categories may be added or deleted to those basic 10. Georgia is one of a handful of states that has a specific category for commercial applicators who apply disinfectants, sanitizers, algicides, and fungicides. Other states without that specific microbial pesticide category do usually regulate the use of pesticides for sanitization and disinfection purposes, just under a more general category, such as public health pest control. Next slide. When we inspect at Georgia Department of Ag any pesticide treatment by a pest control company, we check to make sure a record of the application was left with the customer. The requirements may vary by state, but in Georgia, companies must leave a record that includes certain pieces of information every time they make a pesticide application. This helps us and the consumer to understand what pesticide was applied, how much, and where it was applied, just in case there's an issue after the company has finished. Next slide. Our mission is to protect the health, safety, and welfare of the citizens of Georgia. And to achieve that mission, we assist pest control companies with staying in compliance. We educate the public on pests and pesticide safety and protect consumers through inspections of pest control companies. And these goals are standard for any pesticide regulatory agency. Next slide. Our pesticide applicator licenses are good for 5 years, but that time frame will be different in certain states, territories, or tribal lands. Some out there also have the 5-year time frame, but some have less than that 5-year time frame. Nevermore, we require that licensees either retest or recertify by acquiring a certain number of continuing education units or CEUs during that 5-year period. And this shows us that applicators are maintaining their knowledge and staying up to date on technological or regulatory changes. Next slide. We inspect companies routinely as well as on a complaint basis. During a for-cause or complaint investigation, the inspectors gather samples, statements, documents, photographs, and any other information that can help us understand how the pesticide was used. Our inspector is there to determine whether or not that product was used according to label directions. So again, follow that label. Most pesticide regulatory authorities conduct inspections in a similar manner, but they can provide more detail about their specific requirements if you reach out to them. Next slide. During both routine and non-routine inspections, we verify that an application was made according to the product label, as well as checking pesticide storage areas and the presence and condition of any required personal protective equipment and relevant application equipment. Next slide. Of course, we always hope that we don't find any issues during our inspections, but occasionally we uncover problems that we have to correct. These are just a few examples of unlawful acts under federal and Georgia state law related to pesticide use. With the biggie and my repeated refrain in bold type there at the bottom, you should not use a pesticide in any way that is inconsistent with the labeling. Next slide. We at GDA can issue fines and probationary periods of heightened compliance, as well as take away, revoke, or suspend a company license if we believe that that entity represents a threat to health or safety. Next slide. And I'll conclude by reminding you that regulations vary from state to state. Please contact your state or local or other local authority for specific requirements before offering your disinfection services. Don't wait until they have to reach out to you. Common requirements before beginning to offer disinfection services commercially include having a certified pesticide applicator on staff, acquiring a company license, which we call in Georgia a pesticide contractor license, but may be called something different where you are, acquiring a business license, which is generally issued by the municipality or county in which your business is located, and finally, if your business is a limited liability company, corporation, partnership, or nonprofit corporation, you'll probably need to register with any state where you conduct business activities, generally the Secretary of State's office. Next slide. I know my presentation included a lot of disclaimers, but I hope that it was relevant to what you do or what you plan to do, and that it directed you to folks who can help navigate the specific regulatory landscape of your area. And if you're in Georgia, feel free to give me a call.
Thanks, Jenny. And thanks for sharing that important information about certification and enforcement. I know we had at least a question in the earlier, someone asking about those requirements, so I hope that answered some of their questions already. For our next knowledge check question, we're going to stick another poll up here. Again, select the best answer here. If the state in which you work does not require certification to apply disinfectants, you A, can apply any disinfectant whenever and wherever you want. B, don't need to keep application records. C, don't need to follow any other pesticide laws. D, still need to use registered products and follow the label. Or E, can still purchase and use antimicrobial products classified as restricted use. So feel free to select the best answer there. We'll leave that open for a moment. And here we go. Look at that. Almost everybody says still need to use registered products and follow the label. That is the correct answer. So Jenny, can you make a comment on this? 2% who responded you can still purchase and use products as restricted use.
Sure. And this would be true in any state, if you do purchase a pesticide that's classified as restricted use, you would need to be certified. So no matter where you are, you have to be certified to purchase and sometimes to use restricted use products.
All right, thank you for that question or that response anyway, and all of your participation in the questions there. Next up, it is my pleasure to turn the mic over to Carrie Richards with the National Pesticide Safety Education Center. Carrie will be covering employee safety and training, but focusing largely on personal protective equipment. So take it away, Carrie. Next slide.
Thanks so much. What I want to talk about today is employee safety when using disinfectants. And what's really important is keeping yourself safe as you're working to keep others safe. And if we do the next slide, you'll see that I'll reiterate what both of our last two speakers have said, only in big bold letters. Label is the law, and compliance is very simple. Follow information on the labels of the products that you are applying. You don't need to know everything about every product. You need to know about the products you're applying and what the label directs you to do as far as personal protective equipment, use, and those other types of things. But we're going to focus on your personal protection. So really mostly personal protective equipment that you need and things to keep you safe. On the next slide, you'll see that the place that you really want to focus on is the precautionary statement area that was addressed earlier. It can be anywhere on the label, and the personal protective equipment requirements are sometimes in other areas of the label, but primarily this is the area you want to look for that information about personal protective equipment. It can vary, those PPE requirements can vary between different active ingredients, different products with the same active ingredient, but they're formulated differently, like a liquid as opposed to a granular, between concentrations and ready to use, because concentrations are much higher percentage of active ingredient, and often ready to use are very low levels of active ingredient formulated in with a carrier. And also between liquids and wipes, which is very significant for you all in disinfectants. So the next slide, what you'll see is that that this precautionary statement area tells the pesticide applicator pretty much what personal protective equipment or PPE that is required to minimize exposure. As I said earlier, they may be different for different tasks, and employers should provide the label required PPE to employees. We're going to look at a couple of examples. Start with the next slide that will give you an idea of what we're talking about. This is a germicidal solution, and it's caution, which is one of the lowest signal words as far as toxicity. And if you look at this, it just really doesn't tell you exactly what PPE to use, but it tells you that it causes moderate eye irritation. So you want to consider putting on glasses. Avoid contact with skin, eyes, or clothing. And all of that, it doesn't tell you specifically, but you can gather from that you want to put on a pair of gloves and you want to have long sleeves and long pants. If we move to the next slide, it's a different label, and it more specifically tells you that it causes skin burns and eye injury, but it may be temporary. So it specifically on this product label says, wear safety glasses and rubber gloves. So it gets more, excuse me, detailed about what exactly you need to be wearing. If we look at the next slide, what you'll see here is that we're going to stress that protective equipment requirements can be different for the same active ingredient of different concentrations or, most significantly, different uses. On the next label, in the next slide, you'll see specifically that this label tells you to wear protective eyewear. That's the precautionary statement. But it also tells you if you're cleaning and decontaminating surfaces or areas against HIV, in addition to protective eyewear, you want to wear disposable latex gloves, protective gown, face mask, eye covering as appropriate, because there's a greater risk with not only the product, but what you're trying to control. So if you move to the next one, we'll see another, and this next one really obviously has bigger health concerns because it requires a face shield, rubber gloves, and protective clothing when handling. But it also goes further to tell you if you're using it to control hantavirus, the infection with hantavirus occurs by interrelation of infectious material. So you want to wear coverall, disposable if possible, disposable shoe covers, rubber or plastic gloves, protective goggles, and a purifying negative pressure respirator with high efficient particulate and a powered purifying air respirator with a HEPA filter. So that's more significant and detailed, different equipment you need to use because of the use. The next slide goes on to show you that the most important thing, if you can take nothing away from this presentation today, gloves are the most important PPE to use. Even if they're not listed on the label, it's good practice to get in the habit of wearing gloves. And nitrile gloves, which are chemically resistant, provide not only the chemical resistance, but there are varieties that are like an 8 mil thickness that really fit very well and still give you a manual dexterity and are hot and all the other issues that people have to wear gloves. The reason why this is so important is because gloves reduce potential exposure for 90% when they're worn correctly. And if we'll go on to the next slide, we'll show you that what that means is if you're doing overhead applications, you want to wear your gloves outside over your shirt sleeve, cuff them up at the ends so they would create a little reservoir and catch any runoff. All other applications, shirt sleeves should be out over the top of the glove, again, because you don't want them to get down in the glove or anywhere that you don't want exposure. The next slide, we'll talk a little bit about the fact that there is respirator and other precautions on the labels, and some are vague, like following the manufacturer instructions for cleaning, and know if they don't exist, just use detergent and hot water. But more importantly, these other user safety recommendations: wash your hands before eating, drinking, chewing gum, using tobacco, or using other products that are consumables. Don't use, this is not on a label. Most often I add this at Dawn's request, and it's very important. Don't use your cell phone during applications with gloves, because if you pick up your cell phone, you're going to contaminate it with whatever is on the glove. Removing the clothing immediately if a pesticide gets inside, and wash the clothing thoroughly. Removing the personal protective equipment immediately after handling the product. Wash the outside of your gloves before you remove them, because then you're washing off that residue, and as you remove the gloves, you're not going to get it on the protected hands. So that's super important. But if we go on to the next slide, we're going to talk a little bit quickly about that respiratory issue. Next slide, please. We already mentioned all this. If we go on to the next slide, please. Many labels do mention concerns about respiratory irritation. Very few disinfectant labels list wearing a respirator as required PPE. If you go on to the next slide, it shows an example of a product that does, and very clearly highlighted there, it says, wear a NIOSH-approved particulate respirator and a PRP filter with a NIOSH approval number. This is really most important. That NIOSH approval number needs to be on that respirator. During COVID, when PPE supplies were so limited, there were a lot of fake, if you will, respirators that claimed that they were as good as NIOSH, but if they don't have that NIOSH approval, it doesn't meet the requirements of the label. If you go on to the next slide, it'll tell you that if you do have to have that respiratory protection, you need a medical clearance first to ensure that you're healthy enough to use the respirator, and then you need initial annual fit testing as required by OSHA standards. In the resources, next slide, you'll show you a resource that is listed on the website, and this walks you through the necessary things to make sure that if you need a respirator, you're doing it correctly. The next slide, I want to talk a little bit about some of the things that you need to be aware of, and there's the URL, but that's also included in some of the supplementary information that you provided. But I want to finish up by stressing the next slide, next few slides, talks about what to do if you have a pesticide exposure. Use your common sense. If you think you've been exposed, injured, or poisoned by pesticides, tell your supervisor. And if you go on to the next slide, it goes on to even more common sense. Follow the label, basic first aid directions. There's an 800 number on the label that a professional can offer recommendations on how to treat exposure. For example, the next slide shows you that piece off of a label, and what you're seeing there is exactly what I said. Look for those things and follow those directions. If you still need additional medical help, go on to the next slide, and it tells you there that you need to seek that medical help and provide the information about the pesticide you may have been exposed to so you can get the proper treatment. If you go to the next slide, it provides, I believe it provides my, it just, again, stresses what we've been saying the last two speakers. The label is the law. Protecting yourself as an applicator is simple. Follow the information on the label of the product that you are applying. And the last slide should be the next slide. That's my contact information. I don't know that I'm quite made the 10-minute under rule, but that's about a 40-minute or an hour or 40-minute presentation in a very short period of time. If you have any questions or need other information, my email is there, and our website, where you can find a lot of other resources, is also listed.
Thank you so much, Carrie. It is your lucky day today. But appreciate all that information about, for all of us to keep ourselves safe. Thank you. So now it is time for another knowledge check question. Please select the best answer to the following. Personal protective equipment requirements on a disinfectant or any other pesticide label are A, guidelines to be followed, B, legal requirements, or C, optional in the case of PPE shortage. So we'll give you a moment to select your answer there. And there we go. So we have 66% saying legal requirement and 34% saying they're guidelines to be followed. Carrie, can you make a comment about those results there? Thank you again for your participation,
Sure.
by the way, in that poll.
Sure. The labels are developed and approved by the Environmental Protection Agency at the federal level, and so technically it's a federal violation. It's a federal violation of a federal law if you don't follow those directions to the letter. There's a little bit of wiggle room, but they really do need to be followed as legal requirements. Guidelines, not so much, because companies do a lot of work testing these products before they submit their labels to EPA, so they know through those tests what really is necessary to protect the end user, especially the applicator, when they're using concentrated products.
Great. So thank you again. So the correct answer to that question was that it is a legal requirement. And on to our next slide. Last but not least, our final presenter is Jim Fredericks with the National Pest Management Association, who will discuss business practices and challenges. Jim, the floor is yours.
Thank you, Amy, and thanks so much to EPA for putting this webinar together, and also thanks to the other presenters for providing their perspectives and sharing their knowledge. I really do appreciate the opportunity to talk about professional disinfection services from the perspective of the structural pest control industry. By way of background, the structural pest control industry is an approximately $9.4 billion industry made up of approximately 150,000 pest control technicians working for about 20,000 pest control companies across the US and Canada. And just like everyone else across the globe, the pest control industry was turned upside down last March as it watched businesses shut down and state and local governments issue stay-at-home orders. But True to form, pest control businesses turned obstacles into opportunities. And while our team at NPMA was working hard to educate federal, state, and local governments about the public health necessity of pest control and the need to have the industry designated as an essential service, our member companies were dealing with commercial clients closing their doors and refusing service. Many companies, though not all companies, retooled and retrained their pest control workforce to provide disinfection services, which at that time was in very high demand. The learning curve was steep, but the industry was committed to ensuring that these services were done correctly. The National Pest Management Association convened a disinfection services task force to share and communicate knowledge within the industry to ensure high levels of professionalism and efficacy as pest control companies entered this disinfection market. The task force that we convened was made up of companies that were performing disinfection services, as well as companies that were just considering the service. The experienced companies understood the technical aspects of disinfection, while the novices provided insight into what pest control companies needed to know to get started. As the industry ramped up disinfection services, our members faced multiple challenges, which I will summarize here today. Next slide, please. So, pest management professionals, or PMPs, are not strangers to communication, and client communication is key. In fact, communication is one of the primary job responsibilities of pest management professionals across the country. Communication is one of the pillars of the IPM process, and without it, PMPs have learned that pest management results, regardless of the target pest, are severely limited. In the case of professional disinfection services, PMPs had the skill set, but they needed to learn a new vocabulary. In addition to describing exactly what service would be provided for clients, they needed to educate customers about the differences between things such as cleaning, disinfection, sterilization, sanitation, and had to begin to understand and communicate new concepts such as dwell time or contact time. Now, communication, of course, works both ways. It's important for PMPs to not only communicate the work that will be performed, but also engage in a dialogue about what's expected from the client. Make sure to clearly identify what responsibilities lie with the client and work to clarify exactly what the services that your firm will be providing. For instance, will the service only include public-facing areas of a business, or will it include both the front of the house and the back of the house areas? Ideally, this communication will be provided both verbally and in the form of a written scope of service that will be agreed to ahead of time by both parties. For example, again, is the client responsible for cleaning surfaces before the team arrives? What about food surfaces? Do areas need to be covered or avoided? Do surfaces need to be washed following disinfection? Who's responsible for doing this work? By clearly communicating this information, you not only will be providing responsible service for your customer, but pest control companies will be exhibiting professionalism and protecting their company from future liability. Next slide, please. Personnel challenges. There were a number of significant challenges encountered by pest control companies entering the disinfection services market. It's important to know that not every pest control technician is interested in or suited for disinfection services. Some technicians were hesitant due to concerns about personal safety, despite enhanced training and personal protective equipment. Broadly, there are many similarities between pesticide and antimicrobial applications. For instance, close adherence to label instructions, awareness of PPE, and client relations, just to name a few, but there are also lots of differences. Our members learned early on that these services often required multiple people on a team, and that the work required an additional attention to detail, even though it might be monotonous and time-consuming. For example, The simple act of de-nesting shopping carts in a grocery store, applying disinfectant, then putting them all away can take a considerable amount of time for just one person. So in those cases, teams of technicians were sent out to do this work. Insurance. NPMA has urged member companies to consult their insurance carriers before jumping into this service due to potential liabilities. It's important to describe exactly what service your company will be providing and determine what kind of additional insurance coverage your company might need. In some cases, pest control companies found that their existing insurance carriers refused to provide coverage for their services, so they needed to reach out to new carriers. We encourage pest control companies to do their homework in this area, especially in light of the litigious society that we live in. Be aware, as Jenny spoke about, special licensing may be required for your state. In some states, no additional licensing is required beyond the typical structural pest control license. However, there are states that require specific category certification in order to provide this type of a service, despite the fact that very few disinfectants are registered as RUPs. Keep in mind that some states enacted emergency rules early on in the pandemic, which allowed for special licensing or no licensing at all. But some of these emergency rules may have expired. So it's best to double check with your state lead agency to determine exactly what licenses or certification might be required to perform disinfection services in the state or states that your company operates in. Finally, when it comes to product selection, it is critical to ensure that the disinfectant you intend to use includes the application sites that you intend to treat. Labeled sites may need to include healthcare facilities, food prep areas, schools, commercial buildings, etc. It's also extremely important to consider dwell time or contact time, which is the time that the treated surface must remain wet. Often this is 1 to 4 minutes, but it could be as long as 10 minutes. So consider the surfaces that you intend to treat and ensure that the required dwell time is compatible with those surfaces. And to reiterate Kristen, Jenny, and Carrie's advice from earlier, the bottom line is this: read and follow all label instructions for any disinfectant that you're considering using. Next slide, please. Now, just like reading the label, PMPs are no strangers to personal protective equipment. But providing disinfection services included additional challenges for applicators because, of course, controlling a viable human pathogen is a little different from controlling bed bugs. And so, at the risk of sounding like a broken record, read and follow all label instructions regarding PPE. But in addition to minimizing exposure to the disinfectant product that's being applied, PMPs were also faced with ensuring that they comply with site or industry-specific PPE that might be required by the client. Think bump caps, hair nets, steel-toed shoes for those accounts that are requiring specialized safety equipment. So check with your client to determine what is needed. Additionally, PPE to protect applicators from infection from the virus also needed to be considered. Early on in the pandemic, PMPs found that supply chain disruptions for respiratory protection and gloves were impacted as supplies were diverted to healthcare providers and first responders and increased demand from consumers. Some of the PPE used for disinfection services was new for applicators. And so specific training was required for donning and doffing and caring for this PPE to ensure that risks were kept to a minimum. To meet these challenges, additional training was required in not only PPE, but also application methods, health and safety, COVID-19 specific protocols, decontamination, label comprehension, and communication, just to name a few. As an example, Fomite identification might at first seem like a pretty straightforward thing for a technician to understand, but the word fomite itself was new to many folks. High-touch areas might seem self-explanatory to most, but upon closer examination, there are some nuances that technicians need to be trained on. After all, the top of a handrail is an obvious place to apply disinfectant, but what about the underside of the rail? These are the kind of things that technicians require training on. Finally, what about quality assurance? In traditional pest control, quality assurance comes in the form of active evaluation or passive evaluation. Active evaluation includes scouting for pests following a pest control intervention, using sticky traps or other ways to actively seek out information about pest populations. On the other hand, passive evaluation includes determining if a treatment was a success based on customer response. If the customer doesn't complain about a continuing infestation, then quality has been assured. Now, as an aside, I don't recommend this type of quality assurance. But when it comes to eliminating invisible, microscopic, pathogenic viruses, how does one determine if the job was done effectively? After all, unlike a carpenter ant service, there is no dead viruses laying on the floor when you leave the account as evidence of a job well done. This is where the team concept I mentioned earlier meets the label instructions. Many PMPs incorporated a quality assurance specialist into their disinfection teams. QA specialists help to identify fomites and evaluate, based on the label instructions, the appropriate treatment for those items or surfaces. They also monitor dwell times to ensure that surfaces stayed wet for the required amount of time and were retreated if drying occurred too quickly. Through training and quality assurance, many of the challenges that PMPs faced early on were addressed. Next slide, please. Finally, I would be remiss if I didn't mention a website that was published by the National Pest Management Association in April of last year. PestControlCoronavirus.com was developed specifically for pest control companies, and it includes training for PMPs, webinars, links to state licensing resources, CDC and EPA recommendations, including links to List N, sample contracts, and a comprehensive white paper developed by the NPMA Disinfection Services Task Force that includes much of the information that I've spoke about today. Next slide. Well, this is my contact information. The best way to reach me is email. And with that, I'll wrap it up and turn it back over to the moderator. Thanks so much for your attention, and I'm happy to answer any questions.
Thank you, Jim. We appreciate that helpful information and the resources. And now we have our final knowledge check question. So here's a true/false. Licensing requirements for disinfection or antimicrobial application varies from state to state. Again, take a moment to select your best answer. And here we have the vast majority answering correctly that true. Licensing requirements do vary from state to state. We have a few folks that have answered negatively to that. Jim, will you take just 1 minute to, or a quick second to respond to that?
Yeah, no problem. That is true. So the EPA is going to regulate that EPA registered label, which is going to be really important for disinfection services. But each of the states is going to have a state lead agency and that may require and have specific licensing requirements. And so check with your state before you get into this work, because licensing requirements do vary from state to state.
Great, thanks for that clarification. So on to our next slide. I would like to thank all of our fabulous speakers and you, the audience, for your time, attention, and your participation. That concludes the presentations, but we will continue with a Q&A session. So now is the time to ask your questions using the chat space in the bottom right corner of your screen. And now to your questions. Next slide. We do have a lot of questions that have come in through the chat here. Kristen, the first one is for you. For a general use pesticide, disinfectant, has the EPA looked at the definition of a child, as it is my understanding that is up to age 16? This can be an issue for schools that want to have students take part in keeping the school safe.
Thank you. Yeah, that's a great question. And certainly we have heard feedback on this issue before. So technically there's no statutory definition of children. I can say that there are some work groups that are considering how to address this moving forward. We certainly understand the issue that it raises, having no federal definition of children. So I thank you for raising that.
Thanks, Kristen. Jenny, does the state of Georgia have any governmental employees that apply pesticides? And if so, how are they classified?
Yes, we do. And we actually have a separate category that specifically covers certain kinds of regulatory pest control. It just depends on what they're doing.
Okay, and I imagine any other state, they should still check with their certifying agency there as well for, you know, if there's a government program.
And we do require proof that they are working with a government agency. So we do require identification of that.
Okay. Carrie, would moderate eye irritation statements require glasses, as you noted in the presentation, or proper eye protection, which may be goggles and or a face shield?
If it doesn't specifically say it on the label, it's not required. However, personally, if it has a danger signal word on it, that danger signal word without the skull and crossbones, just the danger signal word means it's a skin or eye irritant. And I would, just as a practice, wear eye protection and gloves. Again, if it doesn't say it specifically on the label, it's not required. That doesn't mean it's not a good idea.
So regular like eyeglasses aren't necessarily proper eye protection unless they're specifically designated that way? Is that?
Yes, correct.
Yeah.
Some people do have their prescription glasses also in the form of a protective eyewear because they don't want to have to wear both. But if they're not specifically designated as eyewear, then no.
Thank you. Jonathan, can you quantify your term reduce the risk, in quotes, reduce the risk?
Thanks for that question. And I'm not sure if it's exactly the exact part of reduce the risk that I was talking about, but I think where we're, you know, the reason I'm using that phrase reduce the risk is we rather than something like prevent all risk or prevent all infections, I think what we're in right now is a situation where there's not a place where we'll get rid of all risk, and so then it's a matter of what's that relative risk of infection, and as it comes to surface transmission, one of the things we're weighing is the risk of catching the virus from a contaminated surface, versus what makes sense scientifically, or what the data support to reduce that risk. And in that situation, I don't have a quantification for it, and I think it's really hard for us to look at that. Some of those quantitative microbial risk assessments, and I'm glad to send those out. Those specific examples do attempt to get at that question of what level of risk, how much are we reducing that risk. For example, the 1 in 10,000, which is kind of at the upper bound of risk. How much would it be reduced if you did hand washing regularly, for example, every hour, every 4 hours, and how much would it be reduced if you did cleaning once a day, multiple times a day? And so all of those things have that they attempt to get at that level of risk reduction, but it's really hard to say to give a quantitative number on that. Because the situations are so different, and in most situations, we don't know. In community settings, we don't know how many people are in that setting that have virus, and therefore how much virus there is being deposited on a regular basis on surfaces. So I hope that helps with understanding my usage of that term, reduce the risk. But I'm glad to follow up with some of the specific quantitative microbial risk assessment resources and publications that we use to inform some of that risk reduction language.
Thanks, Jonathan. And along similar lines, do we know the infectious dose of SARS-CoV-2?
My understanding, this is not my particular area of expertise, my understanding is that that's still not settled science. And so there's still some things to be understood there that are basic calculations needed for, that we use for other organisms. And so just having that basic information makes it really challenging when you don't have a settled science on what's the infectious dose.
Jenny, in Georgia, does antimicrobial pest control fall under agricultural pest control or structural pest control?
And I think this individual also emailed me the question and I answered, but I'll answer it for the group as well. We're unusual I believe we're unusual in that antimicrobial pest control falls under ag inputs, which we have a whole host of categories that don't have anything to do with traditional agriculture that fall under the umbrella of agricultural inputs, including antimicrobial pest control. So it is not structural in Georgia.
Okay. Kristen, I know Jonathan answered a question earlier about Lysol being effective in air, and someone provided an additional comment that Lysol requires a 5 to 10 minute contact or dwell time according to the EPA label. Therefore, it would not be of any benefit in the air. Can you comment, or would you like to share anything further regarding that, or expand on Jonathan's answer previously?
Yeah, thanks, Amy. I appreciate the opportunity. So this brings up a really good point that I would love to make. So Lysol is actually, the brand name. If you actually search List N for Lysol, you'll get a number of products. So when we talk about products, it's really important to know which products we're talking about. Lysol could mean, generic, just using the word Lysol generically, we could be referring to a number of products. So it's really important to identify which product specifically, which EPA registration you are referring to, because you're right, depending on the product, depending on which Lysol product, it will have a different contact time. It depends, of course, on the organism. And then to kind of add on to the, the question about would it be effective in air, so to date, we don't have any products that are labeled for SARS-CoV-2 in air. So again, following the label is critical. And so at this point, EPA doesn't have any data to substantiate those claims. It doesn't mean that in the future, that might not turn out to be the case, but as of today, we don't have any products that are any nationwide registrations approved for air treatment of SARS-CoV-2.
Great, thank you for that clarification. Jim, how can we find out about different requirements or guidances in different industries like schools versus restaurants, hotels, like other kinds of businesses?
Well, in terms of guidance, I think it was said a number of times today, the best guidance is the label. And so one of the things that I mentioned during the talk, and I kind of just briefly glossed over it, but making sure that the application site is listed on the label is going to be extremely important, because you're going to need to determine based on the label whether or not that product can be used, in a food handling area or in a hotel or a commercial facility or a residence. And so the label is going to be probably your most important guide when it comes to what's appropriate for each of those places that you happen to mention.
Great. Carrie, would gloves reduce potential exposure at 90% if the exposure route of main concern was inhalation?
The major research shows that the majority of all exposure does occur on the hands and the forearms. That's why we say 90% exposure reduction is achieved with the use of gloves. However, when inhalation is the issue, it's more important to make sure that the label doesn't require respirator, and because that's what would protect you. The one thing people need to understand is even if the label doesn't require respirator and it says inhalation exposure, I think, well, I'm going to wear a respirator anyway. You still need to have that medical evaluation to make sure you're healthy enough to use that respirator without causing you additional problems, and that it fits correctly so it's actually going to work.
All right. And Jonathan, when the EPA CDC says quote unquote soap, do they mean detergent-based cleaner, bar soap, or either?
In general, what we're talking about is a detergent-based cleaner, or something where a person mixes a detergent with water if they're using it for a home application. That we use soap because soap's used as a kind of a in common language, but generally we're talking about something that's detergent-based.
Kristen, UV lights have been used in medical settings for more than 100 years. Why does EPA say they might not be safe or effective?
Yeah, that's a great question. So it really comes back to the role EPA has in reviewing that information. So, for typical surface disinfectants, we evaluate all of the information, safety and efficacy prior to approval. There's that oversight doesn't exist for UV devices. So, my advice is always to review the data that is provided by the company that's selling that, and try to make a good decision about if that product is safe and effective. So like I said, while we do regulate them, we don't do that pre-market review. And so because we don't have that data on file, we can't say that they're safe and effective. Thanks.
Sure. I think we'll get to, maybe we have one or two, we'll see. Jim, do companies who offer antimicrobial and disinfecting services, such as treatment for COVID-19, need to have a pest control business license? And if so, what specific categories should the qualifying manager have?
That's a great question that I can't answer. And the reason for that is that is going to vary state to state. I think that the best advice in this case would be to contact your state lead agency and ask those very questions to determine exactly what licensing is needed in your state.
And this is Jenny. I'm sorry, I included, just to chime in, a host of resources to figure out exactly who you can contact to uncover that information. So download that guide.
Awesome plug. Thank you so much. And on that note, if we can proceed to our next slide. We have run out of time. So to close today's webinar, I'd like to thank our speakers again for being with us today and for sharing their expertise, and for the IPM Center for facilitating the webinar. We also thank you, our audience, for your interest and your participation. Whether you're experienced or new to offering disinfection services, we hope that you've gained some new knowledge or perspective from this session that will improve your service. Please remember to fill out the evaluation and look for an email to obtain your certificate of attendance. That concludes today's webinar. Enjoy the rest of your week. Thank you.